The following is a paid advertisement for Brown Hand Center. It's been called the world's most common surgical condition.
Painful, definitely painful.
I would have to stop typing and massage my hand.
You talk about hurting, it hurt bad.
Some estimate that it may affect up to 10% of the population.
It's a very scary feeling. It's not just a minor nuisance or annoyance.
Sometimes you wake up and your fingers will be all tingly.
I started to lose feeling at my fingertips. Like I could pick up a fork and drop it.
It was very disturbing. It was just unbearable pain.
Today on Experts in Medicine, carpal tunnel syndrome. We'll show you the symptoms, explain why it hurts, and explore the breakthrough that's helping thousands. Here now is Susan Johnson.
Think for a moment about your hands. You use them for almost everything, your work, your hobbies, all the routines of daily life. But for an increasing number of people, many thousands every year, even these simple actions have become painful and difficult due to a common nerve problem called carpal tunnel syndrome. For decades, the treatment was major open surgery with stitches, scars that were painful and sometimes permanent, and a recovery time lasting for weeks, sometimes months. Who wants that? But now, finally, there's a better solution. I'm Susan Johnson. Today, we'll explore a true medical breakthrough. It's called the Brown procedure, and for many, it is now the treatment of choice for carpal tunnel syndrome, typically with no stitches, little or no pain, and hand use the following day with unrestricted use in 7 days. Ready to learn more? Let's meet some real patients whose lives have been changed by having the Brown procedure for carpal tunnel syndrome. And we'll meet the doctor who invented the historic breakthrough that has helped thousands. Stay with us.
You don't realize how much you use your hands until you start having problems with them.
Not having proper function of your hands and extremities, it can handicap you, let's face it.
I would have to stop typing and massage my hand. Yeah. So it was really interfering with my job.
It started to affect the usefulness of my hand. So yes, it was painful, but when it starts to affect your daily activities, like I could pick up a fork and drop it. Well, I had a newborn. I was concerned about dropping the baby.
Carpal tunnel syndrome is a terrible feeling. It hurts, it's painful, it's a very scary feeling. It's not just a minor nuisance or annoyance.
You would wake up constantly, like every 10 minutes, every 30 minutes. And it was like you couldn't sleep. You'd try everything, positioning and everything, pills.
Pain is radiating from your hand up. So while you sleep, you start getting this sensation of pain that's just shooting up your arm.
In 1947, thank goodness somebody figured out a way to appropriately surgically treat carpal tunnel. The only problem is they had to slice through several tissue layers, skin, fat, fascia, muscle, just to get down to the transverse carpal ligament.
In 2002, I had the open procedure on my right hand, and this is the scar that's left from it. I was off work for almost 6 weeks with that procedure. Being incapacitated for 6 weeks and walking around with one hand bandaged up is real inconvenient.
In 1990, I developed the Brown procedure, which is an endoscopic technique where one uses a tiny incision here. We place some instrumentation inside the carpal canal so that you can visualize the underneath side of the transverse carpal ligament, divide it without ever cutting through the palm of the hand. We typically don't even use stitches. A couple of steri strips, long-acting anesthetic. The patient wakes up and goes home that day. And typically they use their hand the following day and resume normal activities in 1 week.
It took the pain away like almost instantaneously. The next day I didn't feel it.
Easy, less painful, and fast.
Welcome back. I'm Susan Johnson. Every part of the human body is unique in form and function, and among the most complex is the hand. Nowhere else in the body is there such an intricate system of joints, muscles, tendons, blood vessels, and nerves as in the hand. Yet the hands are taken for granted until they become painful. Unfortunately, hand problems and their treatments are not well understood by many doctors. This is changing, largely because of our guest today. Dr. Michael Brown is a world-renowned hand surgeon and the inventor of the Brown procedure for carpal tunnel syndrome and the Brown endoscopic trigger release, two of the most important procedures in the field of hand surgery. He is also the founder of Brown Hand Center, which has successfully treated thousands of patients since 1988 and now has locations nationwide. Dr. Brown has trained hundreds of surgeons from around the world, is widely published in surgical journals, and even authored a chapter on endoscopic carpal tunnel release in a surgical textbook. I'm honored to introduce Dr. Michael Brown.
Hi, how are you, Susan?
Nice to see you again.
Good to see you.
First of all, explain to me, what exactly is carpal tunnel syndrome?
Carpal tunnel syndrome is a pinched nerve in the wrist. The wrist is formed by the carpal tunnel, a semicircle of wrist bones covered by the transverse carpal ligament. That's a confined space. It doesn't get any larger, and through that opening pass 9 tendons, the median nerve, and is surrounded by some spongy tenosynovial tissue, just enough room for everything to fit comfortably. If that tenosynovial tissue swells in response to repetitive type work activities, in response to injury, high blood pressure, systemic illness, even weight gain, then there's not enough room for everything to fit comfortably, and the median nerve is compressed. The nerve is pinched. That's what's become compromised. That causes numbness and tingling in the fingers, aching and pain in the hand, can even radiate up to the shoulder.
Oh, and this is a really big problem, isn't it?
It can affect up to 10% of the population.
10%. Wow. Well, historically, how has carpal tunnel syndrome been treated?
Well, you have to realize the problem is that there's just not enough space for everything to fit comfortably. So the definitive treatment is to open up that space, to divide that transverse carpal ligament, make the carpal tunnel larger. In 1947, open carpal tunnel release was described, and that's an operation whereby one cuts through the palm of the hand through several normal tissue layers just to get down to the transverse carpal ligament and divide it and open it up. A lot of patients and doctors were very wary of that operation, however, because of fear of prolonged recovery or a painful wound, which certainly happens quite a lot with open carpal tunnel.
But the Brown procedure takes a different endoscopic approach. Explain what that means and what makes the Brown procedure different from open carpal tunnel.
Sure. Well, the endoscopic approach that we take means that we put a tiny endoscope, a little camera, inside the carpal tunnel, and we can visualize everything on a monitor. We only have to make a tiny incision here, place the instrumentation on the inside. We can isolate the transverse carpal ligament, safely isolate it from the surrounding tissues, and then divide it, leaving all of the normal overlying structures intact. So after we do that, we simply put on a Steri-Strip here, some long-acting anesthetic. Patient usually has little or no postoperative pain. They can use their hand the following day, and there are no restrictions in 7 days.
Wow, it just sounds so easy and so quick, and recovery time is so much better than what it was like with other procedures, correct?
We've had patients that have undergone an open carpal tunnel release, had a long, painful recovery period. They've known they've had carpal tunnel on the other hand, but avoided the operation, found out about our procedure, underwent the Brown procedure, and afterwards said, why doesn't everyone have it done this way?
Wow, pretty impressive. The Brown procedure has helped countless thousands of patients with carpal tunnel syndrome, and Brown Hand Center is the place where it was developed and is performed every day. We'll find out more about carpal tunnel, and especially the signs and symptoms you need to watch out for when we come back. Stay with us.
Almost half of those who miss work due to carpal tunnel miss 31 days or more. Don't let this be you. Brown Hand Centers are the experts in carpal tunnel. We developed the Brown procedure. Outpatient, endoscopic, no stitches, and no restrictions in 7 days. For carpal tunnel, injury, any problem of the hand or arm, call the experts at Brown Hand Center.
Call Brown Hand Center today at 1-800-214-HAND. That's 1-800-214-4263. On the web at brownhandcenter.com. Brown Hand Centers are the experts in carpal tunnel and all problems of the hands or arms. The patented and published Brown procedure is the treatment of choice for carpal tunnel syndrome. The Brown procedure treats carpal tunnel endoscopically from the inside. It takes only a few minutes. There are no stitches, typically little or no pain, with hand use the next day and no restrictions after 7 days. If you think you or someone you love might have carpal tunnel syndrome, please don't delay. Accurate diagnosis and prompt treatment is essential to avoid permanent nerve damage. Call the experts at Brown Hand Center today at 1-800-214-HAND. That's 1-800-214-4263. Online at brownhandcenter.com.
And the Brown Hand Center will care for you just as I care for my own family.
Daddy's baby girl.
This is a paid advertisement for Brown Hand Center.
Carpal tunnel is thought to affect up to 10% of the population, so it's extremely common.
Painful? Definitely painful.
I would have to stop typing and massage my hand.
You talk about hurting. It hurt bad.
Carpal tunnel syndrome is a terrible feeling. It hurts, it's painful, it's a very scary feeling. It's not just a minor nuisance or annoyance.
It started to affect the usefulness of my hand. So yes, it was painful, but when it starts to affect your daily activities, like I could pick up a fork and drop it.
You would wake up constantly, like every 10 minutes, every 30 minutes.
If the symptoms last beyond 8 weeks, we know from studying almost 15,000 patients over a 12-year period that almost 4% of those people will go on to develop permanent nerve damage. There is absolutely very real risk in not treating carpal tunnel syndrome correctly.
In 2002, I had the open procedure on my right hand, and this is the scar that's left from it. Being incapacitated for 6 weeks and walking around with one hand bandaged up is real inconvenient.
I agree with the patients that have told me after they've had an open carpal tunnel on one side and then the Brown procedure on the other side, why would anybody have anything but a Brown procedure?
It doesn't have any stitches at all. It's very tiny. It took the pain away like almost instantaneously. The next day, I didn't feel it.
Easy, less painful, and fast.
And remember, the goal of treating carpal tunnel is not to reduce the symptoms to a tolerable level, but to eliminate the pressure on the nerve before you get permanent nerve damage.
Welcome back. I'm Susan Johnson, and I'm so pleased to have with me Dr. Michael Brown, world-renowned hand surgeon and inventor of the Brown procedure for carpal tunnel syndrome and the Brown endoscopic trigger release, two of the most important procedures in the entire field of hand surgery. Dr. Brown is the founder of Brown Hand Center, which has successfully treated thousands of patients since 1988 and now has locations nationwide. Thank you, Doctor, for joining us today.
You're welcome. Thank you.
What are the signs and symptoms of carpal tunnel that our viewers should be aware of?
Carpal tunnel syndrome can present with numbness or tingling of one or more of the fingers. Sometimes the entire hand can fall asleep. It can also cause aching and pain in the hand. Sometimes the pain can radiate to the shoulder blade area. Sometimes the hand is clumsy or weak or awkward feeling. It's important to understand that some patients only have one symptom, some patients have two, or some patients have more symptoms. One of the more common presentations is people wake up at night from sleep and their hands are asleep feeling and they will shake them in an attempt to restore blood circulation, but the real problem is carpal tunnel syndrome.
Okay, so the diagnosis, let's talk about that. Is it something that can be diagnosed by your family doctor or a specialist? And is there or are there hand specialists?
Well, a doctor can make a presumptive diagnosis, but the definitive diagnosis for carpal tunnel syndrome is made by measuring the speed with which the nerve conducts impulses across the transverse carpal ligament. And in order to do that, that requires the skill and expertise of a trained electrodiagnostician with instrumentation that measures within millionths of a second, not a handheld portable device.
When should somebody actually see a hand surgeon?
You know, we often take our hands for granted, but in my view, hand function is just as important as eyesight or hearing. So anytime there's a problem, an injury, or a disease process that affects the hand, wrist, arm, elbow, or anywhere in the upper extremity, I would recommend that the person see a hand specialist, a hand surgeon.
Is carpal tunnel syndrome becoming more common?
I think it's becoming better recognized, but carpal tunnel syndrome has been around as long as people have been around. Slight increased risk with computer use, but you don't have to be on a computer keyboard all day long to develop carpal tunnel syndrome.
Is hand surgery a new field?
No, it's not. It's been around since World War II. And the idea was, rather than call in an orthopedist, an orthopedic specialist, to put the bones back together, call in a vascular surgeon to put the blood vessels back together, a neurosurgeon to do the nerve repair, and a plastic surgeon to do the soft tissue coverage, it might be more advantageous to have one surgeon trained in all those areas of expertise as they relate to the upper extremity. So the field of hand surgery was born.
What specific advantages does the Brown procedure have over open carpal tunnel surgery?
Well, the Brown procedure is a very safe, proven, effective, minimally invasive procedure that requires no stitches, typically has little or no pain after surgery. You can use your hand the next day, and there are no restrictions in 7 days.
Now that's incredible that you can just use your hand the next day.
That's right.
No limitations.
After 7 days, there are no restrictions.
Over the last 20 years, Brown Hand Center has treated tens of thousands of patients, literally from all over the world, making you and Brown Hand Center renowned experts for the Brown procedure. Do people sometimes think carpal tunnel is all Brown Hand Center treats?
Surprisingly, yes. However, carpal tunnel treatment only amounts for about 20 to 25% of the work that we do at Brown Hand Center. We actually take care of any problem, injury, or disease process that affects the hand, wrist, arm, elbow, or anywhere in the entire upper extremity.
All right, well then if someone out there is watching and they're feeling numbness or pain or have some sort of a problem with their upper extremity, can they just call the Brown Hand Center?
Absolutely. 24 hours a day, 7 days a week. All they need to do is call Brown Hand Center and we will guide them from there.
Well, that's very comforting and reassuring. Thank you, doctor. When we come back, we learn why carpal tunnel syndrome is not to be ignored. To avoid permanent nerve damage, prompt treatment is essential. Stay with us.
There is absolutely very real risk in not treating carpal tunnel syndrome correctly. If the symptoms last beyond 8 weeks, we know from studying almost 15,000 patients over a 12-year period that almost 4% of those people will go on to develop permanent nerve damage. And remember, the goal of treating carpal tunnel is not to reduce the symptoms to a tolerable level, but to eliminate the pressure on the nerve before you get permanent nerve damage. And you can bet that if the pressure stays on the nerve long enough, one will have permanent nerve damage, permanent loss of sensation to the hand, and maybe even loss of some muscle function in the hand.
You don't realize how much you use your hands until you start having problems with them.
Not having proper function of your hands and extremities, I mean, it can handicap you.
I agree with the patients that have told me after they've had an open carpal tunnel on one side and then the Brown procedure on the other side, why would anybody have anything but a Brown procedure?
In 2002, I had the open procedure on my right hand, and this is the scar that's left from it.
It's a night and day difference.
Being incapacitated for 6 weeks and walking around with one hand bandaged up is real inconvenient.
Now it's been almost 20 years, so we've got a lot of data. Other doctors have reviewed our work and said, yes, out of everything that's out there, we too agree that the Brown procedure is the treatment of choice. Now I get to see this procedure and Brown Hand Centers become more available to patients across the nation.
I mean, you go in as strangers at the Brown Hand Center, but you leave out as friend and family. I mean, they are super.
We have people that come back and say, you know, I thought we treat you like family was just a slogan. That really is the way I felt that I was treated here. Hand injuries are so common. Mashed fingers, broken bones, damaged nerves and tendons. Yet the hands are among the most complex parts of the body. Hand and arm injuries need the care of a specialist from the beginning.
For specialized care of hand, wrist, arm, elbow, all upper extremity problems, not just carpal tunnel, call the experts at Brown Hand Center. 1-800-214-HAND. That's 1-800-214-4263. On the web at brownhandcenter.com. Don't confuse the Brown procedure at Brown Hand Center with other so-called minimal or endoscopic techniques. Other techniques may not have the same record of safety and effectiveness of the Brown procedure, as reported on nearly 15,000 patients in prestigious journals. Call Brown Hand Center today. Your call will be answered 24 hours a day, 7 days a week. 1-800-214-HAND. That's 1-800-214-4263. On the web at brownhandcenter.com. A Brown Hand Center specialist is available to care for you right now.
Brown Hand Center will care for you just as I care for my own family.
Welcome back. I'm Susan Johnson. I'm very pleased to have with me Dr. Michael Brown, world-renowned hand surgeon and inventor of the Brown procedure for carpal tunnel syndrome and the Brown endoscopic trigger release, two of the most important procedures in the entire field of hand surgery. Dr. Brown founded Brown Hand Center in 1988 and now has locations nationwide. Dr. Brown, thank you so much for joining us.
Oh, thank you.
Now tell us, what are the risks of delaying treatment for carpal tunnel?
Permanent nerve damage. If the nerve stays compressed long enough, the nerve itself begins to die, and one is left with a permanent loss of sensation, sometimes a permanent loss of motor function. We have to remember that the goal of treating carpal tunnel syndrome is not to take medicine and reduce the symptoms to a tolerable level and leave pressure on the nerve, but rather to eliminate the pressure on the nerve entirely before those permanent nerve damage changes occur.
Now, the Brown procedure has been in use for about 20 years. What does research say?
Well, we recently published a paper in a very prestigious journal on 14,722 patients studied over a 12-year period, and we answered a lot of questions with that study. One of the things that we found out is that the people that were treated with non-operative treatments, anti-inflammatories and steroids, had double the incidence of permanent nerve damage, not because the medicine was doing anything wrong, but because they had twice the length, twice the duration of carpal tunnel syndrome symptoms. So the longer the pressure is on the nerve, the greater the chance that the nerve will begin to die. We also noticed that those patients treated with non-operative means failed their non-operative treatment about 98% of the time. It didn't work 98% of the time. We noticed that at 8 weeks duration of symptoms, there was already a very small percentage of patients that had begun to have permanent nerve damage. So our recommendation is if you've had symptoms for 8 weeks or more, cumulative duration, proceed directly to the Brown procedure. It's very quick, it's very effective, it's very safe.
Are there any effective non-surgical treatments for carpal tunnel?
Well, our research indicates that the non-operative treatments for carpal tunnel syndrome are 98% ineffective. They fail when taken out to the 5-year point.
What about the ergonomic devices you see at the stores? Are they effective?
You know, a few of them are. Split computer keyboards, the wrist support, special handles for butcher's knives. But remember, the symptoms have to go away entirely.
Do patients ever come to Brown Hand Center after being treated elsewhere?
Yes, we commonly see patients that have had their original treatment somewhere else. The hand is so complex, and the hand function is missed just as one would miss eyesight or hearing. It's very complex, and we believe that it requires the skill of a specialist to get the best possible outcome. So we believe a hand specialist should be involved from the beginning.
Now, the advertising for Brown Hand Center is so distinctive. I think your slogan is, "We treat you like family."
That's right.
What does that mean to you and your staff and surgeons, and what does that mean to everyone?
It means exactly what it says. We strive to deliver a standard of care with excellence and care delivered with kindness and compassion, just as we would want for our loved ones, for our family members. Let's face it, going to the doctor is a little bit frightening. If my wife or my children are sick, it's a little bit scary waiting in that waiting room. We want to let people know that they are in the right place and that we're going to treat them with kindness and courtesy and compassion.
And I can tell that's very heartfelt coming from you. Thank you. And thank you so much. It's been an honor having you on the show today, Dr. Brown.
It's my pleasure.
Well, please stay with us for some final thoughts and important information.
My name is Cassie Pemberton, and I am a mother, and I used to have carpal tunnel syndrome. My symptoms, I don't have any. It's great.
My name is Mike Collins. I'm in the commercial real estate business. I used to have trigger finger, and now I don't. 4 days after my procedure, I had a golf tournament to play in, and I played, so it was fine.
My name is Salita Carson. I work for an energy company. I used to have this problem with my hand, but now I don't. I really appreciate the Brown Hand Center a lot, and what they did for me and what they're doing for others.
My name is Cassandra McGee, and I used to have carpal tunnel syndrome, and now I don't. And any reasonable person would want the less invasive procedure, the shorter recovery period, the least amount of pain.
My name is Linda Sines. I'm a postal worker, and I had carpal tunnel syndrome. Phenomenal. They treat you like a goddess. They're really attentive, make sure you're very comfortable.
The way people took care of me, that's what impressed me probably the most, the people.
Go to the experts. That's the Brown Hand Center.
It's the best. If you have to have surgery, it's the best place to go.
The Brown procedure was convenient for purposes of my lifestyle with the small kids and a family and being able to get back to daily routine quickly.
It took the pain away like almost instantaneously. The next day I didn't feel it.
Easy, less painful, and fast.
I really appreciate my doctor today because this hand is okay.
For specialized care of hand, wrist, arm, elbow, all upper extremity problems, not just carpal tunnel, call the experts at Brown Hand Center. 1-800-214-HAND. That's 1-800-214-4263. On the web at brownhandcenter.com. Your call will be answered 24 hours a day, 7 days a week. Here are some points to remember. Number 1, simply reducing symptoms and pain with medicine or splints is not the goal of carpal tunnel treatment. The goal is to eliminate all symptoms and nerve pressure and avoid permanent nerve damage. Number 2, splints and medication, like non-steroidal anti-inflammatory drugs and steroids, are thought to be ineffective at 5 years and are associated with double the risk of permanent nerve damage. Number 3, carpal tunnel symptoms of 8 weeks duration or more need the Brown procedure to minimize pain and suffering and to reduce the risk of permanent nerve damage.
I want to thank my guest, Dr. Michael Brown. I've learned a lot about carpal tunnel syndrome and the specialty of hand surgery today. I hope you have too. One of the most important things to remember is to avoid permanent nerve damage. Prompt, accurate diagnosis of carpal tunnel is essential. And that diagnosis is best done by a specialist. It just makes sense. You go to an ophthalmologist for your eyes, a cardiologist for your heart, a hand specialist for your hand or arm.
Almost half of those who miss work due to carpal tunnel miss 31 days or more. Don't let this be you. Brown Hand Centers are the experts in carpal tunnel. We developed the Brown procedure. Outpatient, endoscopic, no stitches, and no restrictions in 7 days. For carpal tunnel, injury, any problem of the hand or arm, call the experts at Brown Hand Center.
Call Brown Hand Center today at 1-800-214-HAND. That's 1-800-214-4263. On the web at brownhandcenter.com. Brown Hand Centers are the experts in carpal tunnel and all problems of the hands or arms. The patented and published Brown procedure is the treatment of choice for carpal tunnel syndrome. The Brown procedure treats carpal tunnel endoscopically from the inside. It takes only a few minutes. There are no stitches, typically little or no pain, with hand use the next day and no restrictions after 7 days. If you think you or someone you love might have carpal tunnel syndrome, please don't delay. Accurate diagnosis and prompt treatment is essential to avoid permanent nerve damage. Call the experts at Brown Hand Center today at 1-800-214-HAND. That's 1-800-214-4263. Online at brownhandcenter.com.
And the Brown Hand Center will care for you just as I care for my own family.
Daddy's baby girl.
The preceding was a paid advertisement for Brown Hand Center.